now, the National Department of Health has announced it has received the first batch of treatment for MPox. This as the number of cases has risen to 13, with 2 people having died since the outbreak. The department says efforts to secure more treatment and vaccines is underway to expand. On this, we speak now to the Health Department spokesperson, Foster Mohale. Foster, thank you so much for joining us on Daytime Update. Great efforts have been made to get this treatment. Tell us a little bit more about the treatment.
Good afternoon to you, Masa, and good afternoon to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, we can confirm that we have received the first batch of MPox-specific treatment, especially for severe health complications for all patients who contract this infectious disease and suffer serious health complications. But otherwise, for those who suffer mild cases, we'll continue to manage them with the other treatment that we have been using in order to prevent one more death. As we know that so far we've lost 2 patients linked to this infectious disease. So we are trying by all means as government, working with our partners like your NICD, the World Health Organization, and other local NGOs in the country, in order to ensure that we've got enough treatment for those who test positive. Hence, we encourage anyone who experience MPox-like symptoms to present themselves at the nearest healthcare facility for clinical evaluation.
Yeah, and while we're on those symptoms as well, Foster, just to remind our viewers, what are some of those symptoms?
Symptoms, one of the common symptoms is a rash, blister, or sore sites, as uncommon rash which spreads across the body, very painful, very itchy. Which we encourage people not to waste time. But other symptoms, they are not unique from symptoms of other health conditions. We talk of headache, your body pains, your sore throat, and so forth. Sorry.
Bless you. And also, speaking of those symptoms as well, who's more susceptible? Who should be going and seeking treatment or basically more cautious about this?
In terms of, look, anyone can contract this infectious disease. Of course, there are those who are at a higher risk of suffering severe health complications. We talk of those who are living with underlying comorbidities, like those who are living with diseases like your HIV, your TB, sugar diabetes, and so forth, because their immune system is already compromised. We talk of pregnant mothers and young children. But the bottom line is that anyone can contract this disease regardless of age, gender, and sexual orientation. Hence, we encourage anyone who experience these symptoms, or anyone who was in close contact with someone who tested positive, to present themselves at the nearest healthcare facility instead of diagnosing them. You know that there's a tendency that if you suffer from headache, instead of you going to the clinic, people can say, oh, let me just go and get a painkiller like your Disprin and Panadol. But in this case, we say, especially if you experience these symptoms on a longer term, 3 to 4 days, without any improvement, don't waste time, just go to the nearest healthcare facility, because we interact with many people. Some of them, we don't know their health, their status. Hence we say, please, the best way to protect ourselves is to ensure that we present ourselves at the nearest healthcare facility, but also try to maintain personal hygiene. That is washing our hands with water and soap, or using sanitizer that we used to preach during the time of COVID-19 to say sanitize, sanitize. So we say even this time, continue to sanitize.
Yeah. Now, as you're saying, anyone can get it. So how much stock do we have, and will it be accessible across all 9 provinces or at only the affected provinces?
The first batch that we have received this week, we're expecting more next week, is about 10 doses. As I indicated, that even the first 13 cases that we are treating, not all of these patients, they experience severe health complications. So hence, I know someone will say, no, why only 10 doses? This treatment is not readily available across the world because this disease is not endemic in most countries, meaning that it's not commonly found in most parts of the world. And you remember during the time of COVID, we struggled to access the vaccine. But through preventative methods, we can curb the spread of this infectious disease. But for those who suffer mild complications, we're able to continue to use other treatment that we've been using, like a treatment to manage your fever, your infections, your headache, and so forth, including the smallpox or chickenpox, because these are related to health conditions.
Just for clarity, Foster, if you're saying that the first batch is 10 doses, and we do know that there's at least 13 people who are suffering from this already, that first batch is already being absorbed by those people. When is the next batch going to be brought in?
Yeah, already the first 13 cases, we managed to secure other doses apart from these 10 doses. Already they've received other treatment. As I indicated, that not all of them, they require this MPox specific treatment. So these 10 doses are for the new cases which experience severe health complications. I think out of 13 cases, we managed to use this specific treatment on about 3 or 4 cases. The rest, that's why we managed to discharge them, and they are isolating at home. So this is only for severe cases where somebody really needs treatment.
And because it's hard to get and you've got limited access as well to that question, whether it is available across the country, is it available across the country? And how much did this first batch cost us?
Yeah, no, currently I don't have the cents and the rents in terms of how much we have secured this with, but I can confirm that we also get support from key stakeholders like your World Health Organization, which assisted us to locate where this is currently available around the world. It's true that as I indicated, that this is not endemic disease. So even for pharmaceutical companies, the business won't boom if they produce something which they know that is not going to sell. But we believe that now that this outbreak is experienced in a number of countries, we believe that even pharmaceutical companies, now they will produce more of this treatment in order to ensure that when a need arises, they're able to provide all the countries which are in need of this important life-saving treatment.
Really, truly life-saving treatment needed indeed. Thank you so much for your time and sharing that information with us. That was the spokesperson for the National Department of Health, Foster Mohale.